Good evening. You're watching The Big Story with Haryanto Diman. I'm Olivia Quay, coming to you live from the Straits Times newsroom.
A fourth person has died from Covid-19 in Singapore. The 68-year-old Indonesian man who was case 476 died this morning from complications due to the infection. He had a history of diabetes and hypertension.
Meanwhile, the number of confirmed cases in Singapore stands at 1,000, with 74 new cases identified last night. 54 were local cases and the remaining 20 were imported. A 102-year-old woman is among the new cases as well, and she's the oldest patient here so far.
She is one of the 11 cases linked to a new cluster at Lee Ah Moy Old Age Home at number 1 Thomson Lane. 5 other clusters were also identified this week: a workers' dormitory at 55 Sungai Kadut Loop, the West Light Toh Guan Dormitory along Toh Guan Road East, the S11 dormitory at Seletar North Link, as well as the service apartment block Wilby Residences and Heroes Bar on Circular Road. Infections have emerged in several workplaces recently. HDB closed its Bukit Merah branch today after a second branch employee tested positive for COVID-19. In a Facebook post, HDB said the branch will be closed until further notice. It did not provide details on how both employees were infected.
Meanwhile, Unity Pharmacy has closed its outlet at Next Shopping Centre after one of its part-time retail assistants contracted the virus. It's closed for 2 days for cleaning and is slated to reopen tomorrow.
Yesterday, FairPrice closed its FairPrice Finest supermarket in Bedok Mall after one of its staff tested positive the day before. It also put all staff who worked in the store on a leave of absence, in addition to quarantining the employee. The Bedok supermarket is closed for deep cleaning until Saturday, and FairPrice is helping the authorities with contact tracing.
Experts have said that the next 2 weeks are crucial in our coronavirus battle as we enter a new phase of community transmission. Now we're pleased to welcome Professor Teo Yik Ying. He's the Dean of the Swee Hock School of Public Health at the National University of Singapore. Prof. Teo, welcome. So there were 54 new locally transmitted cases yesterday. Is this an indication that our measures are inadequate, or do you think it's more of a case of people not adhering to these measures?
So yesterday's report is certainly worrying. It's not just the numbers, but also where the infections are coming from. There was a cluster of 10 in a nursing home as well as 3 clusters in dormitories. These are deeply concerning given the density of people within confined spaces. In addition, we are seeing reports that more and more businesses and public spaces are being closed down or disinfecting because of employees being infected. At this stage, the best approach that the public can take is to assume that the coronavirus is already circulating in the community and to act accordingly and responsibly. Our current measures include very strict physical distancing at workplaces and public spaces, as well as an urgent call for people to telecommute, to work from home, to minimize going outdoors. The effects of these measures will take a while, perhaps 2 to 3 weeks before we see the effects. But yes, we should start thinking about even more stringent measures now to avoid going down the route to widespread transmission in the community.
Right. Now, Prof, a fourth person died in Singapore today from COVID-19. Now, out of the 4 deaths, 3 had hypertension. We understand it's another term for high blood pressure. Now, what else can you tell us about this condition, and specifically why those who have it are more defenseless against the virus?
So people who are hypertensive or have high blood pressure are likely to be on specific medications to manage the condition. Now, there have been reports to suggest that one form of medication called ACE inhibitors may be acting in the same manner as how the coronavirus enters cells to make the situation worse. But I must emphasize that there is really insufficient understanding of this at the moment to make a clinical assessment on this. So scientists and clinicians are actively looking into this to make sure that once they have the appropriate information, they can make the necessary decision whether to continue with such treatments because it is just a coincidence, or indeed that there is a mechanism that is similar to the viral actions, and to encourage people to switch medications, to switch to something else.
Right. Well, Prof, we learned yesterday that Lee Ah Moy Home is now a cluster with 11 confirmed cases. So because of that, all nursing homes have banned visitors until the end of the month. Senior-centric activities have also been suspended. But what can we, you and me as an average person, do to keep the elderly safe, especially if we're living with somebody who's over 60 years old?
So there are two groups of elderly in the community, and well, there are more than two groups, but most of them fall into these two groups. The first are the elderly that are in nursing homes. We need to first ensure that the people looking after the elderly in nursing homes are themselves not infected. And this really does come back to the very simple measures that we have. Regular hand washing with soap and water, twice daily temperature checks, wearing a surgical mask when interacting with the elderly, and most importantly, if these workers or volunteers they are not feeling well, they should not go to work to care for the elderly. Same rules apply for any community volunteers that are helping out in nursing homes. Now, the other group of elderly actually are the elderly that are staying at home, that are being cared for by people at home. For members of the public with elderly people at home, the same advice actually applies. This includes very simple measures such as a shower when returning home from work, changing clothes before interacting with old people, in addition to what I've mentioned around personal hygiene temperature checks. I cannot emphasize enough that if a person feels unwell, it is absolutely vital to keep a distance from old people, wear a face mask, and to see a doctor at the earliest convenience. Protecting old people actually comes down to the same approaches as how we protect each other and to minimize our own infection risk.
Right. Prof, so the elderly is one group. Now let's talk about the other group, the migrant workers. There are 3 clusters now at foreign worker dormitories. How can we keep them safe as well?
So the clusters at the dormitories are very worrying, given that these are places where practicing safe distancing is much harder, given the density of people within a confined space. Now, we need to look after these migrant workers just as anyone else in Singapore. They are a part of our society. They have contributed to help the country grow and develop. But what this means is we need them to be similarly mindful of personal hygiene, including temperature taking, monitoring their own health, and to sound out whenever they do not feel well. Now, in times like this, there is a need for employers to also make sure that they put in place a system where workers feel that they are safe to report that they are not feeling well and they have the opportunity to see a doctor if they're feeling unwell. Now, some employers will be against this because this seems to give workers the opportunity to find an easy way out of work. But I have to emphasize, this is not a normal situation we have in Singapore now with the coronavirus. We need everyone, and this includes employers of our migrant workers, to accept there may be the inevitable loss in productivity, but we must be especially vigilant and careful. If migrant workers are at higher risk, then all of us in Singapore are at higher risk. So we have to make sure we put in place a system that workers can report that they are not feeling well. They have a chance to see a doctor at the earliest chance possible.
Professor, we're seeing more unlinked cases. Can you explain to us why such cases are a particular concern for us? Does it because it further illustrates that the virus is entrenched in the community?
So unlinked cases refer to the situation where we have a number of people who are infected, but we are unable to establish where they got the infection from, where they were likely to have been exposed. This means they could have been exposed in their day-to-day routine, getting to work from home and back, where they ate their meals, or the places they have been to, say for shopping or for sports. So one way to think about this is the following, even though I have to emphasize it's not exactly correct. Let's suppose we have 50 unlinked cases today. It actually means that there may be at least 50 places out in the community that a person may be exposed, may be infected from. As I said, it's not exactly correct, but I hope this gives people a way to think about why the government is strongly advising people to stay home unless absolutely necessary and to think about working from home. Now, compare this to a situation where all 50 cases are actually linked within a single cluster that we find out from contact tracing. This means there's actually a point source that we can rely on active contact tracing, find out who are the other exposed people, isolate and quarantine them early to contain further spread as early as possible. So having more cases that are unlinked is a very worrying sign that suggests that there are more places in the community that are seeding infections that we need to be thinking about.
Now, Prof, let's focus on the measures now that Singapore has implemented, specifically social distancing practices. Now, despite the government's continued calls for people to stay at home, people are still going out. Is it because they don't understand the full efficacy of social distancing, or that they're aware of it, but they still choose to run the risk anyway?
So this is common human behavior. I think it's very common for people to think that I will not be that unlucky one. And this is very common when it comes to perception of health risk. And this is really why the government is working very hard, putting in place increasingly stringent measures and eventually turning to legal enforcement to get people to maintain the necessary safe distance in public spaces and to encourage people to work from home, take up telecommuting, really to minimize going out and being exposed to the community spaces that I talked about earlier on when there are unlinked cases. That is the reason why we really need to think about minimizing outdoor movement unless absolutely necessary.
Well, we've seen many comments asking why there are not any social distancing measures on public transport. Professor Teo, is it feasible? How do we keep safe while commuting, especially during peak hours?
So let's be practical in spaces such as buses and MRT trains. Trying to keep a safe distance basically means every bus or every train carriage can only carry a fixed and perhaps a small number of passengers. The question really is this possible? Well, it can be achieved if the majority of the people are already staying at home or working from home. Otherwise, we try to find ways to minimize human traffic at each point in time on public transportation networks. You can try staggering work hours, and this is again coming back. Employers need to take up that responsibility, encourage staff to go for staggered working hours, coming in earlier or later, equally clocking out earlier or later. Even going for lunches, can they now choose earlier timings or slightly later timings, or perhaps even bringing lunch from home? Because this will minimize human traffic in public spaces. But I think the reality is that even when we try to practice staggering work hours, there will still be human people bunching and in crowding. Now, if there is absolutely no choice that one has to go on public transportation, one has to go out, again, getting people to practice personal hygiene is extremely important. What does that mean? It means when you want to sneeze or cough, cover your mouth and your nose. Wash your hands regularly with soap and water. Simple things like this can minimize personal risk as well as the risk to others as well.
Now, Prof, the government has been stressing that we should stay at home. Now, do you think Singapore should implement a lockdown, to make it official, so to speak?
So the idea of a lockdown, it's firstly not off the table. Given the signs that we are seeing, it may not actually be a bad idea to consider implementing what I would call a reboot. You call it a lockdown, I call it a reboot. And this means getting people to stay home, mandating it perhaps for the majority of time, except for essential functions. Do this for 2 to 3 weeks, allow community transmission chains to be broken. More importantly, allow our healthcare system to breathe and to recover. Bear in mind, though, this means that people will be staying indoors and interacting with the family unit more. It doesn't mean that we will completely see zero transmission after the lockdown, because we are just shifting the transmission dynamics from the community now to the households. But households will be much more manageable. We will be able to contain the outbreak better. There's often the mistaken belief that a lockdown will be the magic bullet to solve everything. And that's why the public has been calling for Singapore to be locked down. How we implement a lockdown or a reboot is just as important.
Right. Well, we're not in a lockdown or a reboot yet. Most malls and restaurants remain open, but on the other hand, we've been told to stay at home, and that sounds like a mixed message. So, Professor Teo, if you had a message for Singaporeans, what would that be?
I don't actually think there is a mixed message, because the lockdown allows people to still go to perform the most essential functions, such as getting their groceries, getting their medical supplies. Some work require people to go on. The moment you have a classical complete lockdown where transportation networks are closed, people have to stay indoors, that is going to create additional problems if the planning for the lockdown is not done properly. The message that I have really would be stay at home unless you're going out for a run, a walk, or a cycle to get your daily exercise. Stay at home unless you need to get your groceries or other essential goods. And even so, don't take it as a family outing, but instead perhaps just have one or two people in the household go out to get the necessary supplies. Consider working from home if possible. The Manpower Ministry has already advocated this very firmly, and hopefully this encourages employers to really think about allowing telecommuting as much as possible. And finally, what I mentioned earlier, simple personal hygiene, covering mouth and nose when you have to sneeze or cough, washing hands often with soap and water, taking your temperature twice a day, wear a mask if you're having a temperature or you don't feel well, and see a doctor as early as possible. If you're not feeling well, stay away from family members and friends, especially the elderly, until you are clear that you have fully recovered. That's my best advice that I can give.
Well, it is definitely advice that we should take. It's been a pleasure, Professor Teo. Thank you so much for your insight.
Thank you very much. Thank you.
We've been speaking to Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS. We want to hear from you as well on what you've been doing to flatten the curve, so leave your comments below.
Moving overseas, cases in the US soared to new daily highs for the fourth day in a row. The world's hardest hit nation now has over 215,000 cases and over 5,000 deaths. Italy has reported over 110,500 infections with more than 13,000 fatalities. This accounts for around 30% of all global deaths.
The number of cases in Spain surged past 100,000 as it recorded the biggest one-day death toll from the outbreak. Barring Italy, the virus has killed more people in Spain than anywhere else. Meanwhile, 2 planes packed with protective equipment arrived to restock the country's overloaded public health system.
China's toll of about 82,000 cases and 3,300 deaths remained comparable to several days ago. And this has prompted US intelligence to accuse China of concealing the extent of the outbreak. The World Health Organization said the number of cases globally is expected to top 1 million in the coming days.
Global healthcare systems continue to be under strain as they cope with an increasing number of cases. U.S. federal officials revealed yesterday that their stockpile of medical gear was nearly depleted. There's a shortage of ventilators as demand from states far exceeds supply, and many of those shipped have also arrived broken.
Europe is also facing overwhelmed healthcare workers and crowded hospitals, as well as a lack of testing equipment. In France, the number of people in intensive care is already above its pre-crisis capacity of around 5,000.
Meanwhile, Italy has only a fraction of the 90 million face masks needed each month to fight the pandemic. Amid a global shortage of masks, the WHO said it will reassess its mask usage guidelines.
Tens of thousands of people in Beijing returned to work yesterday, April 1st, after months away from the office. Streets, which were for weeks had barely any traffic, were filled with cars.
Beijing's second ring road, a major thoroughfare going through the capital, even experienced slight traffic jams. Here's China correspondent Elizabeth Law with more on Beijing's first day back at work.
对，我今天要去客户那边，我路过这儿，我去趟银行，挺好的。我跟家待的时间太长了，我觉得恢复以前的生活很好。那没办法，就怎么着，一天不吃不喝了。
在家里已经待的闲的已经闲透了，所以现在复工的感觉挺好。觉得上班吧对自己好一些，老窝在家里不好，感觉挺好的。就是说现在地铁上人很多，流量很大，没有以前就是说我就是没复工之前我也出门 逛逛。然后那个地铁上人很稀少，还有座位。然后现在呢，就是已经很满了。
Well, Elizabeth joins us now live from Beijing. So Liz, in the video we heard two people, Mr. Song and Ms. Liu, saying that they're happy to go back to work. Is this sentiment more widely shared in Beijing at the moment?
Hi, Olivia. Hi, Yan. Yes, so I think this is something this is a sentiment that quite a lot of Singaporeans are probably starting to be able to identify with, because these Beijingers, they've been at home for more than 2 months now. Some of them have tried telecommuting, but I think because of the way the Chinese work structure is and how Chinese companies operate, telecommuting hasn't been quite suitable, or there isn't really a proper infrastructure for it. So for people to actually go back to the office, it's like, yes, finally there's something to do. So quite a few people that we spoke to seemed really excited to be back in the office, whether be it an office building or even going to, because obviously if you work in a shop, you can't telecommute. So yeah, they just seem excited to be able to get out of their homes.
Right. Now, Liz, now that China is getting back to the swing of things, the government is pushing out a message to relax, eat out and shop. But how have the Chinese people responded so far?
I wouldn't say that they really are pushing out a message to relax. They do keep reminding people that we are still in extraordinary times and we do have to be very, very careful. So even if there are efforts to try and get people out, there are still a lot of measures that are in place. Like if you eat at a restaurant, you do have to socially distance. Some places say that you can only have a maximum of 2 people a table. Others say that, okay, fine, if you have a table of 4 or 6, you can only sit in a staggered manner. You cannot face each other. And when you are not eating, so in the past few days that I've been out, members of staff at these places do remind you to always, when you're not eating, please keep your mask on, even if you're chatting with a friend or having a coffee. So there are all these other things. I wouldn't say that it is in a state of relax yet.
Well, Liz, even as restrictions have eased, asymptomatic cases have become the latest focus in China. There are nagging worries that it will see a second wave of infection. So what are the authorities doing to alleviate these fears?
So there are quite a lot of measures. Obviously, imported cases, first and foremost, something that Chinese authorities are very, very worried about. We've seen that from last Saturday, they've said that no foreigners will be allowed in, even if you have a long-term visa. So quite a few people that we know, including our colleague, China correspondent Denson Chong, if he wanted to come back, he would not be allowed in, and other people that we know as well. And secondly, from last Sunday, they've now limited the number of flights. So each airline is only allowed to operate 1 international flight into China per week. So today, the Civil Aviation Authority had actually said that they are trying to limit the number of flights into China per week to about 135. So far, the number is far lower than that. It's about 109. And they are trying to keep it at that level because as of today, there are about 700 imported cases. Most of these are Chinese returning from overseas, pretty much just like the way infections are in Singapore. But still, having these sort of imported infections, still not ideal. Now, that aside, then there are the asymptomatic cases. As of today, there were 55 new asymptomatic cases. And as of now, this brings the total to just over 1,000. But the tricky part about this is that the Chinese government, because of their calculation method, they still don't consider this part of the official statistic, which makes it a little bit difficult to properly track how many cases there are altogether. But the thing is that these asymptomatic patients, they are being kept in hospitals, they are being quarantined. So they are just being treated basically just like a patient. It's just that they're not being added to the official statistic.
Right. You have an article that is out today about top foreign ministry officials from China and Singapore committing to keep their borders open to ensure the smooth movement of essential goods and personnel while safeguarding public health. Can you tell us more about that?
Yeah, so senior foreign ministry officials, the permanent secretary of Singapore's Foreign Affairs Ministry, Mr. Teo Yik Ying, and the vice foreign minister of China, they led their respective delegations in a virtual meeting yesterday, and obviously they talked about a whole range of topics, including what you mentioned about trying to make sure that air and sea freights are still going smoothly, so that important personnel, essential personnel and cargo can move between the countries. At the same time, they also talked about public health measures that both countries are taking. Singapore talked about our approach, China talked about their approach, and also both sides obviously are very concerned about the region, because Singapore being a part of ASEAN and China is a very, very important ASEAN partner. So there is a lot of concern there, and both obviously would try their best to make sure that the situation is controlled within the region. And of course, the JCBC, which Singapore is slated to host the next session, top high on the agenda is public health. So these are things that are in consideration and that we'll discuss.
Well, as always, thank you so much for your time, Liz, and stay safe in Beijing. Of course, that was China correspondent for the Straits Times, Elizabeth Law.
Those are our top stories for today. For more news and videos, do log on to straitstimes.com. Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on The Big Story. In the meantime, do stay safe.